All right. So we're just going to have just wait a few more minutes for people to get connected on here. I know it can get a little bit tricky with folks just trying to get on the internet. So in the meantime, I'll just kind of give everyone a little bit of anticipatory guidance. We're going to do a fun little introduction. I'm all about the icebreakers. My director's always teasing me. She's like, you must have like a file of icebreakers because you have so many different ones. She did a really funny one and I cannot find it. And I think she can't find it either, but it's different pictures of Prince, the singer Prince, and it's like, which Prince are you today? But I can't find it, so I'm gonna have to find that one for next time because I think that one's really fun. All right. So I think I'm just gonna get us started, and if folks join us a few minutes later, that's okay because we'll be able to kind of have a little bit of time for those folks to introduce themselves, I'm sure. So welcome to our second Equity Learning Exchange. I am here to facilitate today. My name is Lydia Marquez. I'm a Senior Technical Assistant Specialist with Strategies TA. I just, for those of you that do not know me, I have a background in mostly early childhood, early intervention, and early childhood infant mental health. So I was a practitioner for some years. So I used to really just be around babies all the time. I always say that's the best thing to quell if you have baby fever, but I guess it worked too well because I only have one child. I always say that. And so I've worked with families. I worked with families for a very long time, but now I'm supporting those folks that are working with families. And so here to help assist me today is Michael Williams. So I'll let Michael introduce himself.
Hi, yes, I'm Michael Williams. I am the Strategies Co-Director at the Child Abuse Prevention Center in Sacramento, where I'm also involved with the California Family Resource Association. My work has come from early childhood with foster youth and in the disability field, and I'm excited to be part of Strategies.
Great, thanks, Michael. And then Anvi Din is our events coordinator, and she is here today. And Anvi, if you wanted to say hi, you can. And if not, that's okay too. So today we are going to be continuing our work around equity. Today is a day where we can interact and learn from each other. For those of you that were here before, I know some folks shared that they wanted to learn more before they had a lot more discussion. And so we wanted to honor that. We'll also have some time at the end. As we continue to do these learning exchanges, we really want to hear from you. What do you need in your work? What do you need to know about equity? What do you need to learn about equity? So this will actually be still an interactive session, and we really want to make sure that we are honoring what your needs are and what your wants are in terms of learning. But we will also be sharing information that we hope will be useful to the work that you do. So let me get my PowerPoint going. So just for all of you to know, we do have American Sign Language interpreters here. So if you need that, we also have captioning that is happening currently as well. And we will be recording this and putting it on our YouTube channel so that if you miss something or if you have a colleague that isn't able to join us today that would like to join us for the next time, they could go back and watch this to kind of see what we talked about. We have everyone muted, and that is just for the background noise, but We will have everyone unmuted because we're going to do just some pair sharing, and then we do want you to interact. We do want you to share your thoughts and ideas or anything else. You can also do that through chat if you feel shy about that. If there's anything that comes up for you, you can message myself, Michael, or Anvi if you are having any issues with your tech or anything like that. Probably for tech stuff, best to message Anvi. But if there's anything like comments or questions that you might have that you just wanted to share with us, please feel free to do that. Also, oops, my PowerPoint decided to go away. All right, can you see the PowerPoint?
We're seeing the website.
Oh, okay. All right, something happened here. Here we go. Sorry about that. I guess PowerPoint decided to do its own thing. You can also use the reactions, and also you can turn your video on or off. I always love to see people's faces, especially if I see their names and I'm like, oh, is that someone I know or not? But also we know that people get fatigued when they've been on so many video meetings. So we also want to respect that, and we also want to, be mindful of that as well. So this event is brought to you by Strategies TA, and it is a collaboration between the Child Abuse Prevention Center, which is where Michael is from, and the Children's Bureau of Southern California, which is where I'm from. And this is funded by the California Office of Child Abuse Prevention. So we are very lucky to bring these events to you with their generosity. Just a quick recap, Strategies TA is really, our work is grounded in these different values, accountability, community voice, strength-based collaboration, and also equity, which is how we're diving deeper into this. These are all really important values to us. This is how we sort of, we hold ourselves accountable. We make sure that community voice is something that we constantly think about. We also look at strength-based as well as collaborative efforts, and equity as well. So just quickly, equity for strategies is just one of our core values. We, as a team, really spent time and intentionally thought about what does that look like for us. And not only does it look like things like this that are grounded in equity and talking about creating equitable systems, but in the primary child abuse prevention work that we do, we always bring that lens of equity to it. So that's just another way we do it. We do it in so many different ways. I don't have enough time to list it all, but it's definitely on our in the forefront at all times. So some of you who attended the first learning exchange saw this. I just think it's just a great little recap of really how we're thinking about equity. Inequity is unequal access to opportunity. So it's like the tree is leaning one way and not the other. Equality is really being able to evenly distribute that. And I think sometimes we think, wow, equality, that's so great. And it's like, well, it is, but it isn't. And so you still see there is unequal access, but it's evenly distributed. Equity is being able to provide tools that people need in order to access what they need to be successful. And justice is really being able to fix the systems. So although our focus is on equity, we hope that it gets to a place of justice where systems offer that equal access to folks. So today, our afternoon, we will do our little icebreaker. We are going to dive into disproportionality and data, and really we're going to explore data. Some of you received the website, so we're going to go through that, like how to use it, looking up some data, and then we're going to talk about, how can we use this data to talk about disproportionality and inequity in systems. I think sometimes this can be a really uncomfortable conversation, and data can help you tell that story and really bring people into it by looking at what you see. What is there? What is tangible? Sometimes when we talk about, inequity, it can become an emotional conversation. And sometimes when you're talking to people who are making those decisions, it may not always, I think, come out in the way that you want. It may not bring people in the same way. So I think sometimes you can use, I always think of data as like the lasso. You're trying to reel people in. So that's kind of what we're gonna explore more today. Oops. So for our icebreaker, so if you're comfortable doing it in the chat, or if you wanted to answer and unmute yourself, please feel free to do that. But the icebreaker is, if you had a talk show, who would be your co-host and why? So I will just go ahead and I will model. So if I had a talk show, my co-host would be RuPaul. I love RuPaul's Drag Race. I think he's like such an amazing entertainer. So that would be my my co-host. So whoever would like to go next, please feel free. And you can also use the chat as well.
Hi, this is Manuel Fierro. I'm from the Children's Bureau as well. I work in a place-based strategies. As a co-host, I think I would choose Oprah because I think I would want to learn from her since she's already done that. So I think it'd be great to have conversations with her and learn from her.
She's definitely my number 2, Manuel, and I was like, oh man, but she might outshine me. She might know more than me. Thank you. All right, so Shannon mentioned Ellen. She's charismatic, funny, and provides a good platform for various issues and topics. I agree. That is true. All right, anyone else?
Sure, this is Michael again. I would Brene Brown. If you ever listen to her podcast, she just gets to the meat of about when she asks questions. It's very fun to listen to.
Oh yeah, I love Brene. I almost forgot about her. I have listened to her podcast, and she brings so many great people to her show. So she'd definitely be a great person to co-host with. All right, who'd like to go next? And again, feel free to use the chat if you did not want to unmute yourself. I know, I guess I got everyone stumped on this one. All right. Ambi says Alex Trebek. Oh, yeah, I think that would be a good one. All right, anyone else before we?
Hi, this is Josie Lewis. I'm from San Diego, Child Welfare Services. I think I would want, and I don't even know if she's still around. Diane Sawyer, is she still around?
She sure is. I don't know if
She's
she's doing anything, but she's I think I see her sometimes on like specials for ABC.
Yeah, she's pretty tough. She's a good, she words her questions very well, which is a difficult thing for me to do. So I think I would like her as my co-host.
Well, thanks for sharing that, Josie, and welcome.
Thank you.
And John Key says probably one of the Obamas because it would be a great conversation. Yes, it would be. They're both very intelligent people, so I'm sure you would get some really great conversation, and they know a lot of people. You could probably get Beyonce as your first guest. All right. Anyone else before we move on? Can do the chat or? All right. Well, thank you for that. So what we're going to do next is we are going to look at the California Child Welfare Indicators Project website. This is a collaborative venture between UC Berkeley and the California Department of Social Services, CDSS. And this website is used to really kind of share data around child abuse reporting rates and children in foster care and things like that. So what I wanted us to do was I'm going to actually go into the website, show you how to pull a few things. Just by, I guess, the reactions. If someone wants to give a thumbs up if they've used this website or use it regularly, just so I can get some ideas. And I'm assuming that if you're part of child welfare, you probably are familiar with this website and have probably used it, but if you could just give me a thumbs up. And so if you go down to reactions, I think you can do that. All right. Well, this is newer to me. Okay, so it looks like Josie has used it. All right. Let's see here. Okay. So I'm going to show you some of the things I want us to look at today. So in terms of disproportionality, I want us to look at the different ethnic groups that are represented in your systems of care in your system, in your counties. So for your county that you currently work in, I'd like us to look at allegation rates. So let me put this website into the chat so I can have everyone, if I could have everyone jump on there right now. So it's in the chat box. And then if you can give me a thumbs up when you've got there, so I know when everyone will be ready to do this. All right, great. Good, good, good. All right, so it looks like we're all there pretty much. Okay, so when you go to the front page, I'd like you to go to where it says allegation rates and view. And you'll see this is for the whole state of California. And actually, I just remembered something. Before we get into this, I wanted Michael just to talk a little bit about, sorry, let me go back. One thing that I wanted to kind of mention was the reason how I got to this website was that I had a really interesting conversation with someone from the Child Abuse Prevention Center, Jasmine Bronson, who did a project around child death rates and Black infant health and African American child death rates. So I think that is how we got kind of to this point of looking at data and ethnic groups, because there is definite disproportionality and disparity happening in our state. And this data that you'll be looking at I want you to really think about, how can that change the work that you're doing? How can it change the outreach that you're doing? And I just wanted, unfortunately, Jasmine wasn't able to be with us today because she had another previous engagement. But I wanted Michael just to kind of touch a little bit on the work that Sacramento County has done around looking at this this issue of disproportionality.
Sure. Thanks, Lydia. Yeah, so the Child Abuse Prevention Center, we were one of the first counties, Sacramento was one of the first counties to have a child death review team. And the CAP Center has been kind of the house, the backbone for that. It's been going on we're in our 30th year now of doing child death review teams. And so it's a multidisciplinary team that gets together and looks at the death reports of every single child. And by multidisciplinary, I mean people from the hospital systems, police, the coroner, and it's funded by the Sacramento Children's Trust. And it looked at, I think it's a real example. Well, I mean, a few things that it brought about are, it's been written up as an exemplary model through the Government Accountability Office and the Administration of Child and Families. It paved the way for Department of Justice grant in California for reducing child death, abuse-related death. But what's a great example of is how powerful data can be, because by taking the long view and a steady look at the data, and with it going to the Board of Supervisors, not just with the report on the data, but recommendations, it actually created new programs by demonstrating the need, including Birth and Beyond, which is our local network of family resource centers, and the Black Child Legacy Campaign, which is now under the housing of the Sierra Health Foundation. And the exciting thing is that, I guess those are all exciting too, but the Black Child Legacy Campaign, because we looked at the disproportionality data, we saw that African-American babies, though 11% of the population, were 30% of the deaths related to perinatal complications, sleep, death during sleep, homicide, and child abuse neglect related deaths. And so they were 11% of the population, 30% of the deaths, and that was just unacceptable. And this multidisciplinary team led by the Child Abuse Prevention Council looked at the programming that would make a difference. There's also a safe sleep baby program that came out of it. And over, I think about the last few years since the Black Child Legacy Campaign started, the rate of sleep-related death for African-American children went down by 50%, and the child abuse and neglect-related death down by more than 50%. And so it really, it saved lives. Looking at the data, looking at the disproportionality, really targeted where intervention should be, and has saved babies. And so that's been an exciting part of the work. And Jasmine is kind of the data guru for the project.
Great. Thank you so much, Michael. So a lot of really amazing things happened when people looked at the data and decided to make shifts in programming and add programming in order to really address those disparities. So really what we want to do is have you look at data for your county. So let me go back because so once you're on the home page, why don't you go to Allegation Rates and View. So we'll click on there. This is for the whole state, so you'll see the data there. On the left, you can click Report Options. I want you to go into 2019 because that's the most recent data. I want you to go into your county. So I'm actually currently I'm in Orange County. So I'm actually gonna look at Orange County. So this is allegations incidents per 1,000 children. So these numbers are for the whole county are 42.8 per 1,000 children. I want to look at ethnic group since we're talking about disparity and disproportionality. That's what we want to look at. And as you can see, the rate is 103.9 per 1,000 children are African American. The next group the total, that's the average, so 42.8. Latinos are 56.4, and then you see some of the other ethnic groups. Native American is 31.6. So just to give you, if you didn't know this, California's trends towards higher rates for children that are African American, Black, and Native American, Alaskan Indian families. So those rates are higher than their counterparts in other ethnic groups. So just so you know. So I'd like you to really explore this data for your county. So this is child maltreatment allegation rates. So these are reports that are made to child welfare. Then what I'd like you to look at is entries to foster care. So these are children that have been placed into foster care placements. So this is just, again, we're going to do the same thing. This is actually more current data. So January to December, we're going to go all the way up to 2019 again. So this is for 2019. Just keep it on child welfare, but you're going to go back into your county again. And I want you to choose your county and then go into ethnic group again. So you're going to see another graph here. You kind of have to hover over so that you can see the different groups. This is, you'll see like the different ethnic groups that are represented here, and it'll tell you as well. So then you can see. So there's missing data here for one of the groups for multiracial. So there's no data that had been entered into there. So that's actually a good question. It's like, I wonder where that data is, or what the deal is. But actually it's pretty interesting. Like for this one, African American, the rate of children in foster care is actually lower than the allegation rate. So just really interesting. However, the Latino group has a really high rate, so that's actually pretty interesting as well. So I'm just going to have you look. Oh, sorry. Go ahead, Michael.
When I was doing it, I noticed that it defaulted to 2011. And if I kept it at that, it actually was really interesting because it included 2019. It did all the way through to the current year and showed some of these long-term trends. So I'm wondering if folks would like to do that in their search.
Yeah, so if you're interested in looking at what the trends are, I think that's a great idea. Just if you don't have to change the year on that. Really, I think it's just looking at what are the different rates in your counties. Has that changed over time? I mean, this is for the state of California. It looks like it's some groups have gone down, some groups have gone up. I looked at one county and now I can't remember which county it was, but their Native American rates were up and down. So it's just really interesting. Like, is that tied to funding for specific outreach? Was that tied to just, relationships within the county of different organizations that worked with this population? So those are all really interesting things.
I was just going to mention that that I was looking at San Diego, and the Native American population was quite high in 2019 compared to, well, it was almost the same as the African American population. So, and I know that our Native American population is not
That high.
right. And we do
Mhm.
have a lot of tribes in the county, but it's just, I was surprised.
Yeah, I mean, so I think it's really an interesting thing to look at. This is actually, and this is foster care placement for your county. So this is, I'm trying to separate this down. It's like not letting me do it. So it's acting a little wonky on me here. But I think that it's probably right under here. That's probably why it's not working for me. But anyhow, it's just interesting to see those different trends happening. And, like you see some up and down here in this group. So it's just, I think it's just something for us to think about.
Right. Well, and I think the other thing that's interesting is, so this is number per thousand. So it's not the total numbers. It's not like there's a
Correct.
higher number of Native American kids in the system, but it's a higher proportion of those kids. And I think also with the smaller population, the variation could be more dramatic because the difference of a couple of kids is a couple kids total number is a bigger difference in the percentage or the per thousand rate.
Yeah. And, I think it's also good for us to think about like what are some of our assumptions that we have before looking at this data? And what are just some of the things that, we want to consider when we're looking at this. So if you need any assistance with getting on here or want me to look at anything else again, just let me know. There's a couple of things. So we're going to give you time to do this. I want to, when you're looking at the data, oh my goodness, it's like PowerPoint, everything. We're in Mercury retrograde. Everything's acting wonky on me today. All right. So when you look at your data, and we're going to actually do a pair share after this, but just what are some of the trends that you're noticing? I think it's good to also think about like what are some of the assumptions that I made before looking at data. Because I will tell you that I made a lot of assumptions about what the data would look like for Orange County, which is a county I live in, and was really surprised when I saw some things happening like trend-wise that I was like, wait, that's really interesting to me. Um, and then also, I think trying to look at like what is your county doing to address this disproportionality? Like if you're aware of any initiatives, if you're aware of any targeted outreach, what are some of the things that you are noticing or that you know about? And what do you think, what more can be done? So just some questions to think about. You don't specifically have to like answer these or anything, but I think it's just kind of things to think about while you're looking at your data. So I'm gonna give you 15 minutes. If you need more time, I'll check in around the 10-minute mark. If you need more time or less time, we'll kind of know then. I'll just check in to see where everyone is at. Does that sound good? So go ahead and give me a thumbs up if, or you can say yes if you want to. All right. So great. Thank you. I'm like, is anybody out there? All right. Oh, Anvi, we're not doing the rooms yet. Sorry.
Should I close it now?
Yeah, they're doing the, they're just doing their things. Oops. All right, sorry, you guys weren't supposed to be in breakouts just yet. Were folks already done pulling their data? We are going to have our breakouts. Sorry about that. I think it went into the breakouts before we were ready. So, do you all need maybe 5 more minutes to pull out the data?
Yeah, so it went into the breakouts early because you want people to have time to dig into the data first and be
Yeah,
ready
and
to
then
talk about them in the breakout.
yeah. All right. So when everyone has pulled the 2 data sets that we looked at on the website, go ahead and give me a thumbs up, and then that'll let us know to put you back in the breakouts.
Lydia, this is Lisa.
Yes, Lisa.
Hey, I'm sorry. I think just with the newness for me of the site and everything, I missed the 2 distinct data points we're looking at. Can you repeat those?
Sure, I'll go back because I think someone might have joined us later, so I wanted to, I can go back, no problem.
Okay, thanks, Lydia.
Yeah, for sure. Okay. So let me go back. All right. So go ahead and we'll start from, okay, my computer is decided not to cooperate. All right, hold on, give me 1 second and I will get us back here. All right, so, sorry, let me just get us back to let's go back to the beginning. Here we go. So just the 2 that are here on the front page. So we'll go back, let's start with the allegation rates. So we're gonna look at these. And then Lisa, what county are you in?
I'm with Sacramento County.
Okay, awesome. So if you wanted to see the trend from 2011 until 2019, which is fine, you're going to get the same sort of data. Let's go down and we'll pick Sacramento. Here you are. And then for row dimension, we want to look at ethnic group because we want to see those different trends that are happening.
I missed that piece. Okay.
So this will tell you where your trends are. So Sacramento County is pretty much on trend with the state. So this is 134.3 per 1,000. All right.
Okay, so when we click on the thing that says report options.
Yes.
Pick our county, and then then we scroll that down, and the row dimension is ethnic group. Got it.
Yes. Okay. So let me close this and we'll go back to the front again, the main page, and we'll look at entries into foster care. And then we'll also do the same thing here. We'll just leave it January to December. And you'll pick your county, whatever your county is. And then also on row dimension, we'll do ethnic group. We'll just leave all the other data in there. Okay, so this will show you your data for, and then if you hover over, it'll tell you like the different ethnic groups and the different rates there. And if you really want to get crazy with it, you can look at the data table and it'll give you actual numbers. If you want to explore that a little bit more. All right. Anyone else have questions about this or want any help with getting there?
So I'm not getting, like, I went into ethnicity and I was not getting the line charts. I was getting bar charts. So I'm not sure what I did
Like
wrong.
this?
Sideways bar charts, actually.
Oh, really? Huh.
Yeah.
Well, let's look up. So this is for your, well, let's look up your county. Okay, I can spell. All right. So this is yours. This is for entries into foster care. So let's see. So these are your numbers. It's interesting because there's not data for, well, that's weird. Like multiracial is usually the pink, but I guess that's not, it's not been reported to this.
Okay.
But this is for beginning in 2011.
Now I can't get back in it. The link went away on the chat box.
Oh, let me put it back in.
Okay, thanks.
Okay. All right, so how are folks doing now? So thumbs up if you've been able to pull your data out. All right. So if you need to go into the website again, I put the link back in there as well. This is actually a pretty interesting website, and I think it's good to just kind of play around with it a little bit and look at it just to see some of the other categories that there's data that has been reported, and just look at, you know, ethnic groups so that you can kind of see, you know, where is disproportionality happening in your county? What are some of the groups that you see this trend over and over again? We go into the breakouts, we're going to do just a pair share. And really what I want you to do is just spend some time sort of talking about, you know, what was your initial, I think, you know, assumption about what the data will say about your county? Were you right or wrong about that assumption? And also, you know, think about like, what was your reaction to that? What does that tell you? And how does that inform your work? So a lot of things I think for us to just think about. So I'm going to put that in the chat. So. Oops. All right. So we're going to have you go back into Breakout rooms. If you did not want to participate, please decline. That way we can put, we can put people into groups of folks that wanted to have discussion. So we're going to do that for 20 minutes. So try to give at least each person about 10 minutes to just talk and frame your discussion around the questions that I had put in the chat. If your discussion goes another route, that's great. I think that they're just to kind of help guide if you want to get the conversation going. So Anvi, take us to the breakout rooms. And the interpreters, you can just decline. We'll just have you stay in though. All right, awesome. Great. 20 minutes. Welcome back, everyone. Hello, hello. Hopefully you had some time to have some good discussions. So thank you all for getting your data together. I know that it's like an extra step. We're making you do work here. But I think I wanted us to have the data so that it could help really inform some really deep discussions about what this means for our work and what it might mean going forward. So what were some things that you discussed or some things that resonated with you as you were looking at and reflecting on this data?
So I can go. Manuel and I discussed, the data that I looked at from San Diego County, and the fact that I was surprised with the Native American data. One of the things that came up is that I mentioned that a lot of our tribes out here have their own social workers and are beginning to form their own infrastructure. And so I was thinking that maybe they are reporting more, and that's why the data is trending that way. I was also surprised that the data was not higher, that the numbers were not higher for the Latino community here in San Diego, because we are so vast. And so we kind of talked a little bit about that. And so yeah, it was quite an opener to see the different points that are coming up here on all this information for San Diego.
Thank you for sharing that, Josie. Yeah, it's really interesting when we start to look at the numbers and really start to reflect on how that looks for us in the work that we do. So we did actually a webinar last month. Oh my gosh, I can't believe it's already June. The beginning of May, on engaging Native American families. And I think it's really important. One thing I learned that I really wasn't aware of was that many times, because of surnames, Native American families will be identified as Latino when in fact they are Native American. And because of just, I think there's some names that actually are Native American in origin, but sounds like a Spanish surname. So the assumption is automatically made, especially with how someone might present in the way that they look. So I think it's interesting for us to always think about that and also, figure out like, how do people identify and what is the history behind that? And anyways, I can get deep into it, but I can share that webinar for those of you that are, curious in learning more on how to engage Native American families, especially when you see those very high disproportionate rates in your systems. Oh, thank you, Michael. Michael did it for me.
Thank you.
Yeah, so I think it's great to kind of just, I think, get a little bit more context into how those numbers might be affected by some of those historical traumas and things that have happened. Anyone else? Anything else you sort of resonated with you as you looked at the data, or something that resonated with you when you had your discussions? And again, you can always use the chat as well. I hope discussions were happening in that time.
I'll share a little bit. So I was meeting with Dawn and Christine, right? I'm sorry, drop names.
Sorry,
Yeah, Christine, right?
Shannon.
Oh no, Shannon. That's right. So we are all from Sacramento County, and so those programs I described that reduce child deaths were great, but that didn't necessarily translate into more equity in the child welfare system, that the disproportionality was still there upstream in the system. And so we talked about addressing family stress and systems issues and systemic structural issues that you need to go deeper with that for solutions. So Shannon and Donna, I don't know if you would add anything to that.
Well, one thing I did while everyone was in their groups was look at re-entry rates for different ethnic groups. This is really interesting to me. This is actually over from 2009 to now. It's just, I don't know if it's incomplete data on Native American families, but I don't know what happened there. It's kind of weird. I think it kind of went up and then here, and then I don't know if there's like not data reported or what's happening here. But it really is on trend as a state that Native American and African American families are some of the highest referred to child welfare in foster care for the most part on average, and have the highest risk of being re-entered into the foster care system. And we had a speaker from the Florida State Child Welfare System come and do a webinar on equity in this system. And this is actually a national trend as well, especially for African American families. So as we're thinking about this and we're seeing these trends happen, and I know that there are some counties that actually that isn't the trend. We might see more Latinx families. We might see more Native American families who are, in their systems. But thinking about this, what are some of the ways in which you see your work changing as you're looking at this data? And not to put San Bernardino Yankee on the spot, but I know that they were actually looking at some of this data a couple of years back and looking at how they could really, address these two groups and some of the rates that they were seeing. So I don't know if you feel comfortable sharing, Junkie. I know I kind of put you on the spot.
No, that's fine. I kind of discussed it in our small group for San Bernardino County as the lead child abuse prevention council. We in 2018 were thinking for the child abuse prevention plan that a lot of counties are opting into. We were going to take a look at the disproportionality rate in the child welfare system in San Bernardino County, and I think the work hadn't gone off the ground. We had just begun, but we were putting out, ideas, in order to address disproportionality. What does that look like? And I actually just shared with Lisa that to kind of get that started, our child welfare director a few years back did contract with the Cultural Responsiveness Academy, or CRA. And she was actually able to bring CRA specifically for how to work with African-American families in the child welfare system to our county. And so she allowed me to sit through that 9-month training course. And I was just saying how, even though I'm not specifically directly working with families, but as the CAPC of our county, how can we kind of incorporate the work of an understanding of historical trauma, or that disproportionality, or the inequity, and how do we use that in terms of like the training or our educational materials that we develop. And so it was a great course to kind of really understand that historical, to bring it from that historical lens and understand how all of that is now translating into the inequities we're seeing in our system today. So we're still working on it. We're still trying to figure out how to get that off the ground, but we recognize it's a big piece of the pie to start with. So I hope that helps.
Yeah, thank you for sharing that. I think that is, something that is, it's like a big project, a big thing for folks to tackle. So I think it can feel very overwhelming at times. And so, just the fact that, you guys were looking at this, you were thinking about this, you were looking at the data and really sort of paying attention to like, what do we need to do in order to address this in our systems is huge. And I did just pull up the reentry data for your county. And so I'm interested to see like what this means on these. I'm not as familiar with this website, so I don't know like when things are like partially, maybe there was only partial data input in there. And so that's why it's doing that, because there's some years I think that were not in here. That's why the data looks like that. So anyways, anyone else, like how would this change what you do and change the work now that you've sort of seen your county and maybe there's some surprises. I know, Josie, that you mentioned like, wow, Native American families, I didn't even realize that this is a disproportionate number for our county. How will this change the way in which you work?
Well, I think I'm going to bring this information back to the groups that I participate in San Diego and have them look at this, because right now San Diego is mostly focusing on African American families, which is a good thing. And, but I think that we also need to look at the Native American communities and kind of explore that, maybe reach out to the different tribes and try to figure out why our numbers are high there. And then perhaps start working on putting something in place to address that, because I know that has been addressed in the past. And that was why a lot of the tribes, had started their own infrastructure, but I don't know if it was, if it has been addressed recently. So.
Great. Yeah, thank you. And I think that's such a great, plan, is to, like, you've seen this data, now you're going to take action. And I just think that that's, and this is like in real time that this is happening. So I think that's really inspiring to hear that, you're like, wow, I saw this. Now what can we do about it? So I appreciate that.
Yes, and I want to thank you for sharing this. I'm excited about the data and all that, because a lot of the people in San Diego are very into, like you said, we have to wave the data in front of them and the statistics and things like that, and then that's when we're taken more serious, because we can talk about it, but unless we show proof, then we're not really taken serious. So thank you
Right.
for that.
Thank you. Thank you. Appreciate that. Yes, I mean, part of what we're trying to do too is just, what are some additional tools that we can share to help inform the work that you do? And so I'm glad to hear that this is like, wow, this is something that I can use. And I think even if you don't work in the child welfare system, I think this information is really important, especially when you're doing prevention work, right? Because you're like, well, let's look at this. You know, why is this group being referred to child welfare more than other groups? One of the things that we did not touch on, but that is interesting to me, is to really sort of go into a place of wondering about the data. So yes, we see that certain groups are being, you know, reported more to child welfare. We see some families that actually have more substantiated cases. But at the same time, we want to ask, I wonder about that. Like, why are these groups being referred to child welfare so often? One of the things that I'm hoping that we can have a discussion around in the future as we continue these groups is poverty. I think that that goes alongside of, you know, race. I think it can also contribute to how people are reported to child welfare. So I think that that is something else that I hope we can kind of touch on as well going forward. But I also oftentimes wonder about how poverty plays into someone's view of a family and their ability to take care of their children, and when it, especially when it comes to things like neglect. And the webinar that we had on disproportionality in the system, I always forget the titles because I racial equity in the child welfare system. That particular webinar, she does touch on that, because particularly African American families in poverty, they are actually some of the highest group that is reported for child neglect. And so when you think about that, you know, you think about, for example, I was having a meeting with one of the counties that I support in child abuse prevention. We were just talking about how, you know, there are families who, for example, can't afford to wash clothes all the time because they're living in poverty. You know, if you live in an apartment, you have to take your clothing to a laundromat. Like, let's say you don't have a car. Let's say that the, you know, laundry facilities at your apartment are really expensive. Um, I actually had to do laundry at a laundromat because our washer broke, and I was like, this can be really expensive if you have a large family, or just even if you don't have the extra money to do that every week. And then you have to send your child to school, and let's say that you just are barely making ends meet, you know, then what ends up happening is, then, you know, you have a teacher who says, like, this child is coming to school unclean. And then, you know, not knowing the circumstances, it this sort of gets this ball going. You know, how can we sit and wonder, but then balance out, like, yeah, if you're a mandated reporter, you have to report certain things, but how do we sort of educate our community in trying to support families and really sort of figure out solutions to these things rather than put children into the systems? So just something I think for us to think about when we're thinking about equity. It's not always just about, you know, racial or ethnic groups, but also thinking about disparities in economics, thinking about things like sexual orientation and gender identity. So there's lots of ways in which equity plays out. So I want us, just when we start to think about this in a deeper way, especially when we're looking at data, is your county collecting data like that? So that is actually a question I do have, is how does your county, if you know, or if you think about it, how are they collecting data on some of these other things that cause disparities in our systems? Or are they not? So if you know they are not doing that, let me know in the chat, because I'm curious about that. And actually, if you could just share what your county is again, because I'm just curious about who might be, like, collecting data on families and things like economics, or things around gender or sexual identity, or if those things are being considered in the work that you do. So you can also use the chat if you did not want to. So I know in the work that we do, we oftentimes think about all of these different ways in which families are together, or how families, you know, different family makeups. We try to really consider that. And I know that sometimes, it can be really easy to default to thinking of families in one way because that's what our experience is. We may work in communities where there's still very traditional family structures, but how do we sort of just either consider that there are different family structures or different, I guess, ideas on how families are, and how can we sort of keep track of that so we're always sort of adjusting to those things? So I just put a question in the chat if you wanted to answer.
Lydia, I'm sorry, could you just explain what you mean other families again?
So when we think about families that you typically may not be serving, so, I think we have, like, some of us or some folks might have like a very specific neighborhood they're serving or community. How can we anticipate that there may be families serving that we haven't had an experience with? So maybe there's families that, you may see that communities change their ethnic background might be changing in a community. How do you sort of anticipate those changes? Like how can you adjust? How can you think about, I guess, even different family structures, like not just single parents or two family parents, but you may have like extended family members who are part of a family. Like how can you adjust, or always just sort of, I think about those things, because I think sometimes we kind of can get into the rhythm of like, okay, these are the families we've been serving. So just thinking about that.
So I don't know
sorry.
if,
Go ahead.
sorry. I was just gonna say, I don't know if it will necessarily answer the question, but one of the things that San Bernardino County has been looking at, of course, I know across all counties, we've seen it, is the rates of child abuse going up and the severity of abuse, of course, during COVID-19. And one of the things that as the CAPC and child CFS that we, CPS, one of the things that we're looking at that I think other counties are already doing, we're just a little bit behind, is how do we re-engage our family resource centers to act as those conduits and those connections to the communities? Because again, the strength of those resource centers is that they're in the communities that need the assistance. And some of the trends that we were seeing is that the cases that were the referrals that were coming in were just general neglect, meaning it was basic needs that our families need. And so we were trying to see how do we connect or engage our family resource centers to hopefully be that, I guess you could say, that blockade, or, you know, like to mitigate some of the families coming into the centers. So that's something that we're doing in San Bernardino County. And I recognize that sounds like differential response, but we don't necessarily have that in our county. So we're kind of trying to see how to do that prevention work with our families. So using that community voice is going to be the most important.
Yeah, and I think, you know, engaging community voice and community leadership, something that Michael mentioned, I think that's a way to do that, especially with family resource centers, I think have a pulse to the community. And I think, how can we help support their learning? And then I think it rolls into what Manuel says about, you know, having training available for cultural sensitivity and highlighting different family structures. I think that is something that is important. Is, you know, we don't know what we don't know, right? So how do we continue to increase our capacity in learning about different things and just being open to that? Like, how do we create a culture within our organizations to model that curiosity, right? Or, you know, just always think like, what more can I learn? What is out there that I don't know? How can we do that? So I think, I know that that was one of the things that you were, Junkie, considering for your organization when we were talking about this disproportionality, is like, how can we help people learn about what this looks like, and maybe even try to explore some of the factors of that. And then Josie mentioned, look at the types of allegations, where they're coming from, then engage workers in cultural sensitivity for those specific communities. Yes. And it's, you know, what does that look like for your community? What does that look like for your organization? You know, how can we also consider biases that we may have? I actually went to a conference yesterday, and I heard the speaker, and she was talking about something, she called it disruption. And basically it was really around, how do we sort of disrupt ourselves? I thought it was going to be like this really social justice stuff. She's talking about disruption, so I got like really nervous, because I was like, oh my gosh, what is she going to ask us to do? But it had to do with like, how do we disrupt ourselves to get into this uncomfortable place, and really kind of question like, I wonder why I think this. And one of the things she mentioned was about education. And I was like, okay, I've been guilty of this. So thinking about education as like this superiority. So, you know, if you have a certain level of education, then you must know about X, Y, Z. You know, if we think about parents who maybe have a higher education, we might expect more. If we know that parents have don't have the same education, we might expect less in when we work in these systems. Or we might, you know, provide different kind of support when, you know, that should just be tailored to the individual. So it was really interesting. And I think it really got me thinking about, you know, what are some of the biases that I have, and how can I really be aware of those, and how can I really support this work, and think about, you know, these in what ways do I need to increase my capacity? So anyways, very interesting stuff. Anything else? How will you change your practice going forward? I'm just curious to know. And again, please use the chat if you don't feel comfortable unmuting yourself and talking. Although I do love to hear people's voices, but you know, I also want to be mindful that not everyone is comfortable with that. So one thing I heard actually yesterday that I thought was really interesting was If we don't live and examine life, we won't grow. There's an author, his name is Jason Reynolds. He's written a lot of books. Actually, he has a book out now called Yoga for the Brain. And I think this is so important. I think this, you know, idea of examining ourselves and inequitable systems can feel very uncomfortable. And at the same time, hopefully every time you leave this group, it really pushes you to grow in a different way. And hopefully when you come back, it's like the flower will bloom in different ways. So that's what we hope happens. Josie also mentioned the comment, biases lead us to make erroneous assumptions. Examining biases, feeling uncomfortable with our biases means that we are actually breaking through. Yes, that was perfect timing. So, when we looked at the data, I mean, I kind of was like, well, where I live, I'm sure I'll see, a higher number of Latinx folks that are in the system because that's a majority of the community that I live in. But actually, that was not the case. And so I was actually really surprised, but that was actually my bias. So it was a good time for me not only to look at the data and really get a better understanding, but also try to think about, well, why do I have that bias? What has led me to that point, and how can I change that? So I think that is a way that data can not just help us inform the work that we do, but also think about what is the work that I can do for myself, on myself, with myself, that that can help as well. So I think that is another way in which data can be helpful. All right.
Just that sparks a thought for me too. When you're looking at the systems level and if families are impacted disproportionately, everybody in the system might say, well, no, I try to treat everybody fairly and I try not to be biased and I don't think we're biased. But if the numbers make you honest that whatever you think you're doing, if you're still producing this outcome, then you need to do something different.
Right. Yeah, that's such a great point. Because I think sometimes it can be difficult to say like, well, wow, I'm part of this system that's doing this. And I think sometimes our systems have been set up in such a way that we're sometimes working against systems that we're part of. So, it's like, what can I do to start to change that? How can I bring the data to decision makers and say, look, I'm noticing this, like, how can we change this? So I think that's how data can really help you tell the story. Or, it can be like, well, we focused on this group and now the numbers have gone down. How can we start to focus on another group as well? How can we change our strategic plan around this? So I think that is definitely something for us to consider, is using data really to tell the story, because I think it can be very convincing. If we tell a story of somebody and say, this kid came into the system and this was their experience, that's, most people can, I think, sympathize with that. But I think that having the data, it is hard to say that's not really happening when you see the numbers. All right. So any last thoughts, any thoughts that you might have about this data, the website? How did any of you feel about the website? I'm actually curious about that as well, that we used today. Is anybody out there? Okay, great. So yeah, I think it's a great thing to explore. I mean, just even seeing other counties, I think that it's great. I'm glad that you all found it informative and a good resource. And it's great to kind of even see some of the other counties maybe that you are curious about. And I think it might even be a way to connect with other counties and figure out like, oh, I noticed this rate went down over time. I wonder how they did that. So if you're doing prevention work, I think that can be a really great way to connect with another county. And
Yeah.
great
Oh,
resource. Yeah.
I was so Janki, I think you're the person on in this meeting who's most in the middle of prevention planning and the strategy support for prevention planning. And part of the support we want to provide to counties, although we don't have this explorations, part of it is helping you plan to address disproportionality. And I'm wondering how can you picture ways you might use this website or the graphs you get off it to engage your county partners around addressing disproportionality?
Definitely. I think again, when we started this work back in 2018, I think we were just and I wasn't a part of that process, so I don't know where they pulled the data from. But when our groups have been talking, we really at the time didn't have data sets to look at, and I think using this this site is going to help us pull information that we're going to need, whether that's permanency, whether that's entries into the foster care system for the very first time, and looking out, what other inequities are we seeing within the county? Is it just our African American children? Is it our Latinx families? Is it our Native American? So I think we're going to be able to take this and really, I think, use it to our benefit to really kind of put some data behind the action that we're trying to get. And I think, again, I think it was Lydia that said it, is like when you have data, it tells a story that you're trying to get across, and numbers don't lie, right? So it's actually going to help my cause.
Yeah, that's great. And I think it's always good to have like this evidence, this backup. Sometimes I feel like I should have went to law school because I'm like one of those people that's like, well, here's the statistics. I'm definitely a data nerd, so I love to see the numbers, but I think it really does help you, sort of, right, have that piece of information that is factual, but that you can explore. It can be a conversation starter. It doesn't need to be like the end all be all of what you're sharing, but it can definitely get the conversation started. So I definitely appreciate that. And I appreciate the people that do all the work to get it there. So, because it's a lot of work. So we're kind of getting to the end of our afternoon together, and I appreciate you all, engaging in conversation, and hopefully we will have more of these. And so speaking of the year ahead of us, we are going to continue to gather like this and learn from each other. I think that one thing I wanted just to reiterate is that you all have so much experience that you can share that can actually help other folks that are doing child abuse prevention work and prevention planning. And we want to just acknowledge that and also let you know that, yes, we are here to help facilitate that learning, and we will, help bring folks that know about certain things and bring certain topics to the forefront. But ultimately, we want to make sure it is things that you need in order to do this work, things that aren't always readily available to you all. So one of the things I wanted to do was just leave a few minutes for you all to share in the chat. Well, we also have a Survey Monkey that you can leave us with some additional commentary. But just now, I think, what are some things around equity that you still have questions about? What are things that you want to go deeper into in terms of equity and creating equitable systems in the work that you do? And I will actually put the question in the chat as well, because I asked a lot of questions. So I'll put one succinct question in there. But just thinking about that, and you can use the chat to enter that in, or you can unmute yourselves. So I'll give folks a minute. One of the things I did mention before too was learning more about how poverty affects families. All right, Josie, how would you suggest that we address the issue of how having the training and right tools for the workers ties into how equity for the communities that we serve? So I just want to make sure I have this right. Are you talking about like capacity building? Okay. So maybe knowing more about like how to do capacity building to prepare your workforce. Okay.
Josie, what is your, what county are you in and what's your role? Oh, you're in San Diego, right? What's your role and how do you connect to the people who need to know this?
All right.
To raise a good issue that this training and capacity issue is something that it's a systems issue that needs to be available across the system. So, you know, might not have that connection right now, but how can that conversation happen at a county level about the training and capacity needs? Oh, and you're on committees. Yeah.
Josie, are you part of your prevention planning team?
So I don't know that San Diego, it's taking too long for me to type it.
Yeah.
No,
Yeah.
go ahead.
I don't know if San Diego is looking at things through the prevention lens at this time. I want to say that that's the feeling I get. I think we're starting up. I'm in the training, one of the workforce training committees, and they are looking into better preparing the incoming social workers and continuous training for workers that are already out there, things like that. Because as a matter of fact, I that was one of the things that I brought up is that we need to basically put our house in order first because, as a leadership, they can't expect us to go out and serve a community properly when we are not being trained properly, I guess. But there is some resistance, of course, to change. And so, and all these suggestions were great as far as community outreach, which is there's one area that goes out and they do a lot of community outreach and things like that, but not necessarily in a preventative sort of way. I don't know if I'm making that clear. So I guess the bigger question that I'm trying to ask is, how do I begin to bring that forward as far as, hey, maybe we should look at this through a preventative sort of way, um, instead of being a reactive kind of model. Let's be proactive, and put things in motion that will um, just prevent all the different allegations that are coming in for our minority communities and things like that. How do I do that? How do I voice that so that I don't step on any toes, sort of like? Which
What,
that's why I'm excited about the data, because I think that that's going to be a good resource for me.
yeah. What committees are you on? I'm just curious because
Right. Oh, right now I'm in it's the bigger committee. It's called Diversity and Inclusion. And then from there, there's some subcommittees. So I'm part of the workforce subcommittee, which used to be the training subcommittee. And then I'm also part of the placement subcommittee, which looks at the type of families that we're recruiting. It looks at different issues as far as the disparities in the families that are both that we serve and that we recruit to be foster families, things like that.
So committees within child welfare.
Yes.
Okay. So I know that well, San Diego is working with us because they have a primary child abuse prevention planning team. And I know that they're focused on early childhood and have some, other projects. But I think that recently they've mentioned something about looking at disproportionality. And so I'm sure that eventually it will get to where, where your work is in these committees. But I'm wondering if, let me talk to my director, because I think there needs to be some kind of like connection made there, because I think that, yes, definitely, I think capacity building is really, really important when it comes to this kind of work. But I also think it begets to sort of this larger thing of that, how does the culture of your whole organization, your whole community, um, kind of focus on equity, right? So it's like you can train your workers to, you know, um, recognize their implicit bias, right? Or be culturally sensitive. But if the system itself is not, then it's kind of like they're going to start working against each other. Does that make sense?
That makes perfect sense. And yes, there is a disproportionality. I mean, there's a huge wave of going in that direction. And that's how this whole thing got started, because we have the diversity and inclusion committees and things like that. And so, which are addressing the disproportionality. So we're just at the beginning stages, though. And
Mhm.
so, as far as the child prevention, I believe that that was part of the last wave where they put in, the QP, the quality improvement, and then there was also the all the
Mhm.
different. And I don't remember my words now, but the where incoming referrals, and they would get the special meetings and things like that. So there was a whole system that was set up. But I think that we need to take that, what was already worked on, and maybe um, combine it with the work that is being done now.
Mhm.
And during our breakout session, what my partner mentioned was that it's something very fluid. So, it almost seems like, and I'm not just talking about San Diego either, but in child welfare itself, it almost seems like, a system it's put in place, and then it's looked at, okay, so we're gonna do this, and it's gonna address this, and it's gonna end this. But we need to think of it as a fluid thing, like it needs to be ever changing in order to address the different trends and the different things that come up, because like you said previously, if something is put in place that addresses one disproportionality in one ethnic group, and then that gets kind of fixed, it levels off or what have you, and then something else pops up, then
Mm-hmm.
the agency, whatever agency it is, needs to be able to address the next one. So we can't just, it can't be static. It needs to be fluid. You know what I mean?
Yeah,
And I don't,
exactly.
now I'm going off on a tangent here. I don't know if that makes sense, but
No, it does. It does. And I think it's a good point. It's like, I think that's how people can feel very overwhelmed by the changes that need to happen to create an equitable system. Because it's almost like, that, have you ever seen that game with the little gophers that pop up and you're like, that's what it feels like. And so we need to really sort of like, how do we sort of coordinate so that we're able to just totally, reimagine the system so that we can, have it so that we're not doing that all the time. One thing, I don't want it to get lost in the comments, but Manuel mentioned looking, along with looking at equity, looking at, ACEs and which impacts families and children. Coincidentally, at the conference I was at yesterday, they had one of the original researchers, Dr. Robert Anda, who actually spoke about racism as an ACE. It is not part of the original study and it's not part of the original metrics, but it definitely is one that he mentioned as something that he wanted to consider because it is a traumatic event for children and for their families. So I think there's definitely a tie-in there. So we want to do that. So I am going to do a time check. So we're right at 3 o'clock. I don't want us to go over. And so I wanted just to check in real quick. I know Anvi, do we have a Survey Monkey? If we could have folks just kind of click on that link to help kind of give us some feedback. I know some of you maybe weren't able to share some of the feedback in terms of like how you wanted our next year to go. I would really love to have folks stay engaged. And also, if you know folks that are interested in this, that you think need a space to, come in here and learn about these things. I think sometimes it can feel very intimidating to say like, I really need more capacity building around equity. I don't think that someone actually said this to me when I did this the last time. They said, I don't want people to think that I don't want equitable systems, and that's why I don't know about it. But a lot of times we just don't know because we just don't know. So this is a great space for us to be able to have that, to be able to do it together as peers and share things and share that time together. So again, we are going to put this on our YouTube channel. So I want to share that if you could please follow us on YouTube, Strategies TA. We do have a lot of really great webinars around equity, around disproportionality that I think would be helpful if you wanted to learn more. And we will also follow up with just an email with some of the resources that we shared today as well. So I won't take any more time because we're a couple minutes over, but I really appreciate you spending your afternoon with us, and hopefully we will see you again. And we will be restarting these coming up during the summertime, so we'll let you know when the next one is. So hopefully you can join us. So thank you.
Thanks, everyone.